Once an emergency call is received in the 911 center at the Houston County Sheriff's Department, an ambulance is dispatched to the location of the call. Here at Houston Healthcare, we have one paramedic and one EMT on that ambulance. Once the ambulance arrives at the scene, they'll respond directly to the patient and do an assessment of what is wrong with the patient, looking at their surroundings, speaking with bystanders, and then of course speaking with the patient. The paramedics and EMTs are trained in pre-hospital care assessment, which includes doing a full head-to-toe assessment of the patient using medical equipment such as cardiac monitors, blood pressure cuffs, glucometers to test blood sugar, and other advanced equipment. Houston Healthcare EMS responds to well over 25,000 responses a year. And in fact, in 2015, we responded to 28,515 responses. These responses could be anything from auto accidents to people having heart attacks. Houston Healthcare EMS trains extensively for disasters throughout the year. We train both within our department and also with our allied agencies, with the hospitals. Some of the training we do is, first of all, we certify all of our EMTs and paramedics in what's called the incident command system, so that in the event of a big disaster, a multi-casualty incident or something that's very technical, our people have been trained in how to take command of those situations. In addition, we do hands-on training with our folks as a department, but also with other agencies. One of the things that we're very excited about is we train very extensively with Robins Air Force Base, with their emergency management personnel, their fire department, with the medical group. EMS enhances the experience of the patient because they're the entry door to the healthcare experience, whether they're coming to the emergency department or they're being transported from one hospital to another to have surgery. I feel that Houston Healthcare invests in the community most basically by providing an EMS service to the community. The hospital-based EMS service is the best way to do that because the paramedics or the EMTs are the eyes and ears of the doctors, the nurses, the other medical staff of the hospital. Our folks receive intensive training by having the relationships with the doctors and nurses on an everyday basis. One of the groups that we train with is the Georgia Search and Rescue, or GSAR group, which is specialists from the fire department, from the police department, from heavy rescue and industry, and also with the EMS. Houston Healthcare EMS works with the Houston County Emergency Management Agency for planning for disasters, both within the community and here at Houston Medical Center and Perry Hospital. We train all of our employees in their orientation and in their annual training what they need to do in a disaster. However, since disasters don't happen even every day, we also give them tools to assist them when the disasters happens. For example, we have what's called a job action sheet, and each employee can access this and go down a checklist of what they need to do in an emergency.